veterinary medicine has one of the highest suicide rates of any profession. And
Wow.
a lot of this is frustration driven because pet owners are angry. Corporate is owned by private equity and it's all about the bottom line and making money. Where do I see the future of the profession if we don't turn this around? If the FTC or somebody doesn't step in, it's kind of a nightmare.
Hello, everyone, and welcome to another edition of The Measuring Post. Joe Massa here, in a place where we can learn and grow together. And today I've got a really exciting conversation because it's one that I know a lot of people will really vibe with what the topic is about, because everybody loves our pets. We never talk about pet health here on The Measuring Post, and I figured it's about time that we did that. Me, as the owner of a 15-year-old, well, almost 15-year-old puggle, I can definitely say I'm a lifelong fan of owning a dog and cats. We've grown up with them, so I'm really excited to learn a little bit more today. So with that in mind, I brought someone in who's an integrative veterinarian with over 40 years of experience. She's a pioneer in holistic pet health, a best-selling author and educator, the founder of Naturally Healthy Pets, and an advocate for natural healing and better nutrition for animals. Today, please welcome Dr. Judy Morgan to The Measuring Post. Dr. Judy, how are you today?
I'm doing really well, and I'm very happy to be here.
Yes, thank you for giving me some time today. And when you kind of came across my radar, I knew instantly, oh, we absolutely have to do this because, like I said, right outside my door here, there's a 15-year-old puggle who I can't let in the room because she snores so loud, even while she's awake. Just
I
got
have a
that
few
puggy.
of those.
Yeah. So, and I love her to death. Her name is Bowser. But we've been blessed. She's been really, really healthy. But we've also had some pets when I was growing up with my parents that didn't get so lucky. Some that had cancers, some that were diabetic, some that had these issues where they had a very short lifespan. So before we get into all the healthy things we should be doing for our pets, tell me a little bit about where you got started from. It sounds like you've been doing this for quite a while.
Yeah, I'm literally from the land of the dinosaurs. I've been around for a very long time. I started out in very traditional medicine. I graduated from veterinary school at the University of Illinois in 1984. So we are talking mid-'80s, Midwest America. 100% traditional. Like, if I had ever brought up any of the things I do now, they probably would have kicked me out thinking I was just off my rocker. But I did practice traditional medicine for the first 10 years, and I was really unhappy. I did not like it at all. And I almost left the profession because it just felt like we were spinning our wheels and going nowhere. And then I accidentally got introduced to alternative therapies by taking a chiropractic course. And I did not know that that's what it was until after I was there for a few hours. And I said, I think this guy's talking about chiropractic medicine. I don't know if I believe in this or not. But I finished the course. I paid a lot of money. And then I went back and started using that in my practice. And I was blown away. Animals that couldn't walk when they came in ran back out the door. And that was so powerful that I thought, well, what else is out there? And so I just started dabbling in almost everything. And it's kind of one of those things for a lot of people that are in the holistic space, we play with a lot of different modalities, and then suddenly we find what hits our hot button. And so when I got around to looking at traditional Chinese veterinary medicine, I took an acupuncture course. That was my first thing. And then through that, I discovered herbal medicine, and then also discovered food therapy and started incorporating that into my practice, started writing books about it. And it is amazing how many diseases, particularly chronic diseases, we can totally reverse using just food. Food is so powerful if we get the right food. And so we've been doing so many things wrong in veterinary medicine that the average life expectancy for a middle-sized dog, so think medium-sized golden retriever, in the 1970s was 17. Now it's 10. We're going
Wow.
backwards. We're doing everything wrong. And so I've spent the 40 years kind of looking at what we're doing wrong, what we can do better, and how we can reverse that. And my husband and I are very active in rescue work with all animals, really. We have a farm with a bunch of rescue animals of all sizes and shapes. But a lot of our dogs that we've rescued came to us with tons and tons and tons of health problems because the rescue groups that we work with are kind of like, oh, well, she's a veterinarian. She can take care of that. It won't cost us as much. She'll fix it. And using our holistic methods, we have turned so many of them around. We ended up adopting way too many of them, which is fine. At one time, we had 13 dogs.
Wow.
But,
Yeah.
our dogs, we raise Cavalier King Charles Spaniels and English Toy Spaniels. We have a Cocker Spaniel right now, too. So we're a Spaniel family. But most of ours are living to be 17, 18, 19. And that's after getting off to a really bad start and coming to us with just tons of problems. And we can turn them around and we can give them a really high quality of life for a long period of time. And so that's really my goal since I've gotten out of clinical practice and I'm now in e-commerce and education with naturally healthy pets. And so my goal is to educate and empower pet parents around the world to give their pets more vitality, longer lives, better health, and do it without using all the chemicals.
So I've definitely seen some videos of people that do chiropractic work on animals, and it's actually pretty fascinating to see. I even saw one guy doing things on a snake, which I didn't even realize they had like a bone structure. But
They do.
it was really powerful to see sort of what that looks like in animals. And we've had people on our show where we talk about nutrition and taking care of your physical body for the humans. It would make perfect sense that that applies to our furry friends, right? So I love the work that you're doing. It really makes a lot of sense to why you would need to feed them better things to give them a better chance at being healthy long term. So, sort of what are some of the practices and the turning point that really got you away from traditional veterinarian medicine? Like obviously taking that chiropractic course, but now you're running a farm. Was there like an aha moment where you're like, maybe this westernized, regular taught medicine practice isn't the way to go about it?
Well, it was really interesting. In the acupuncture course, I had no background in Chinese medicine. I didn't know what yin and yang and all the different things were. And so a lot of the people that were in that intro course, the very first part of it, uh, they had more background in it than I did. And so they would be talking about different things that they were seeing in their practices. And one of the things, and I talk about this in my first book, where I called myself the pet food salesman, where when I was in school, there was only one company that made prescription or therapeutic diets, and they're all given letters of the alphabet. So KD is kidney diet, HD is heart diet. And in our medicine class in school, we were told, well, if they have kidney disease, they all go on KD. And if they have heart disease, they all go on HD. That was all we ever learned about nutrition. We didn't learn how to formulate diets or balance things for animals. And so I'm sitting in this acupuncture course, and somebody next to me says, oh, well, in my practice, all the traditional vets, they just keep prescribing that killer diet. I'm like, what are you talking about? KD, killer diet. And I'm like, okay, well, that's a new acronym that I hadn't heard before.
Yeah.
And I had been working in a practice where literally every patient was put on a prescription diet. So the old ones were put on GD, which is geriatric diet, and the young puppies were put on PD, which was the puppy pediatric diet. And I, had to sit back and look at it and say, okay, why are they calling this killer diet? And I had to start looking at how pet food is made and looking at ingredients. And let me tell you, I stopped pushing prescription diets and I started really looking at how we were feeding our animals. And once I started moving away from traditional practice, started looking at vaccines and how often are we giving them? And do we really need to give them that often? And what side effects are there? And how are we not equating the chronic disease that we're seeing with the medicine that we're doing? And so I started rethinking and changing my protocols for everything. And because I was starting to get a reputation, I had clients bringing me these really just off the wall cases that were, had been seen by 7 different veterinarians, were chronic problems. One client brought me a dog who had been put on antibiotics for chronic diarrhea. had a very bad reaction to it, and it caused aplastic anemia. The dog's bone marrow shut down, wouldn't make any more red blood cells. The dog went to the University of Pennsylvania for multiple blood transfusions and was put on very, very high doses of steroids and immune suppressants. And after a couple of months of therapy at the university, the dog was making 0 red blood cells. And the university said there's nothing more that we can do. That owner came to me with that dog and said, "Is there anything you can do?" And I said, "I've never even heard of this. This is really crazy. Your dog had the weirdest reaction I've ever seen in my life." And I said, "I don't know. I'm not going to make you any promises." So I put the dog on herbs. I started acupuncture on the dog, and I designed a diet for the dog, all designed at helping this dog make red blood cells, supporting the bone marrow, the immune system, and took her off all the immune suppressant drugs because of the side effects. And within a couple of weeks, the dog started making red blood cells, and she did a 180-degree turnaround, very healthy. And so when she came to me, she was like 7. She ended up living to 15 and died of something totally unrelated. And, I started getting more and more of these cases that it's just like, nobody else can do anything with this. But, they've been treating the dog with immune suppressants for chronic allergies, chronic inflammatory bowel disease. And all they're doing is throwing more and more drugs at the pets, and they're not getting better. And so we have to look at it and say, well, if we continue to do the same thing, it's like banging your head against the wall nonstop and wondering why you still have a headache. It's like we have to change what we're doing. We have to change the paradigm. We can't keep doing the same thing and expecting a different result. So we have to do something different to get a different result. And we just kept seeing so many cases that we were turning around. And for me, it's a miracle. But it also made me realize that the thing is, you can't patent a lot of these herbs. You can't patent food. I mean, you sort of can, but it's not something that you're going to make billions of dollars off. For me to design a diet and hand somebody a recipe, I could charge them for that recipe, but it's a one-time deal. They're not coming in month after month after month to buy more food from me. They're not coming in month after month to buy more drugs from me. What they are getting is a lot of happiness and a lot of health.
Yeah, and that's really important. So you actually said something that is, I want to touch on a little more. You talk about the vaccines that they get. Are there a lot of animal vaccines? I don't really remember. I've had my dog for so long now, and we actually got her. She had already gotten her vaccines. Is that something they're supposed to be getting regularly, or is it like time of birth? Obviously, the more things we put into our pets are bad, but I'm a bit unaware. How many vaccines are out there for animals?
A lot, really a lot. So if we were to give every vaccine that is available for our dogs, oh Lord, they might get 20 a year, which is a lot. They don't need them. And what we need to look at is, how long does a vaccine last? So we have vaccines that are the core vaccines that are recommended for all dogs. And then we have core vaccines for cats. So for dogs, the core vaccines are rabies, distemper, hepatitis, parvovirus. And now they've recently added on leptovirus or leptospirosis, which used to be a lifestyle vaccine. They moved it over to core vaccines. I guess the companies weren't selling enough, so they talked them into that. But there are rattlesnake vaccines. There are Giardia vaccines. There's kennel cough, Lyme, influenza. There's a lot of different things that we can throw at our pets. And a lot of veterinarians recommend that we give all of those every single year. Well, we know that the core vaccines like distemper and parvo and hepatitis last anywhere from 5 to 7 years, and for some dogs, they'll last a lifetime. So why are we saying that we should be giving boosters every single year when it may last a lifetime? We have a very easy way to test whether they have antibodies. We can do a blood test called a titer. The problem with the titers is a lot of veterinarians don't want to do them, so they jack up the price. They say to a client, well, the vaccine's going to cost you $38. If we do a titer, that's going to be $350. Which do you want? Well, people are a little bit cost conscious right now. And, then the next question is, well, is it going to hurt to vaccinate my dog? Oh, no, we can vaccinate him every year and it's not going to hurt. Well, it does hurt. Are seeing so much autoimmune disease, so much arthritis, so much chronic inflammatory disease. And every time we throw something else at the immune system, like another vaccine, it stimulates that immune system, and now we end up with cancers, we end up with autoimmune disease, autoimmune hemolytic anemia, chronic inflammation. So and we also need to look at the individual pet's lifestyle. My dogs rarely leave my farm. If they leave my farm, they come to my office, and there's one or two other dogs here in the office, and they're very healthy dogs. So why would I want my dogs to get 27 different vaccines when they have exposure to nothing? Where we run into trouble is for people who want to take their pets to boarding, grooming, daycare, training, competitions. A lot of those have very strict requirements for over-vaccination. And so it's been partly my job and other people like me to try to educate those groups, like the boarding facilities, the daycare facilities, the dog parks, the groomers, and convince them that there's a better way to do this and that we're causing more problems by over vaccinating our pets. So a lot of veterinarians have very strict protocols. All puppies must go through a series of 3 or 4, whatever they set, a series of vaccines. So they're having you come in every 3 weeks for another group of boosters until your dog is 4 to 5 months old. Well, it's not a one size fits all. We have to look at the breed of the dog, the size of the dog, the exposure, you know, uh, what their history is, what they're going to be doing in the future, and we really need to be doing individual, tailored protocols for each animal. But it takes time to have that conversation, and veterinarians are overwhelmed, overworked, rushed, and particularly if they're working in corporate medicine, corporate will set the protocols, and they don't allow a whole lot of room for free thinking and individualized protocols, and that's a huge battle that we have as well.
Yeah, and I think we see a lot of that in traditional medicine for, humans as well. It's
Oh, absolutely.
it's it's way easier just to pump them with a new drug, give them a new pill, give them a new shot, and it's easier to have that conversation. And again, it all comes down, I think, a lot of it to, they got to keep peddling their vaccines, and the more they sell, the more money everyone makes. And
Yep.
dogs get sick, that means veterinarians get busy. It's sort of a flywheel effect, unfortunately, instead of thinking about the best options for our pets and the well-being of them. But it sounds like what you're describing really is more like holistic
Yeah.
veterinarian medicine, and it's not so cookie cutter is the way that things are presented.
Right.
Everyone has a unique physiology, and every animal does as well, even if they're the same breed, same litter. Whether it's you and your sister, me and my brother, we might be very similar because we got the same mom and dad, but we might have completely different physiological needs and things going on internally. So you
Exactly.
can't give him what you give me and vice versa. And you can't give that to your Labrador and your poodle and expect them to have the same outcomes. I would imagine
Right.
you see a lot of that where they say, let's just do the same 3 options we give to everyone and pick A, B, or C. And then from there, move on. And best of luck. We hope your pet does really, really well.
Exactly. And so, I mean, we know for a fact, it's been documented that the more vaccines you give at one time, the higher the risk of the pet having a severe reaction to it. And the smaller the breed of dog, the more likely they are to have a reaction to a vaccine. And so that reaction can be life threatening. They can have an anaphylactic reaction where they go into shock right after you give the vaccine. And I saw it so many times in practice with small breeds. If you have a dachshund, the chances of them reacting to vaccination are really, really, really high. Little tiny 3-pound dogs, really high chance that they're going to have a reaction to a vaccine. And in my practice, if a dog or a cat has a reaction to a vaccine, they never get vaccinated again. And one of the problems with giving multiple vaccines at the same time, you have no idea which one they reacted to. So it's Russian roulette next time you give them a vaccine. And if they have a reaction once, every time they get re-exposed, the reaction will get worse and worse and worse. I had a client in my office one day, and I was really trying to convince her that we should just do the titers on her dog. Our titers were not very expensive, but it was going to be like $90 for the titers versus $30 for the vaccine. And she didn't want to spend the extra money. And she had a small breed. And I said, I really, really would rather do, like, if your dog has a reaction, we're going to have to do IV fluids and steroids. And, we may have to pull out the crash cart. This could be ugly. And she said, no, 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 go ahead. I've got a lunch date. Just give him the vaccine. I want to leave. I said, okay. I gave the dog the vaccine. By the time she hit the front desk, the dog was having an anaphylactic reaction. We had to run the dog to the back, get out the crash cart, get out the IV fluids. And it ended up costing her a lot of money to save the dog because she didn't want to spend the extra money to do the titer. And, to me, it's like, I'm not trying to talk people into something because I want them to spend more money. The money has nothing to do with it. I could offer you both for free. I'm just trying to get you to do the thing that is going to be less of an issue for your dog. So, and she happened to be a new client, so she wasn't quite as familiar with my way of doing things. So I think I kind of caught her off guard. But, once that dog had that reaction, I said, your dog should never be vaccinated again. Now, I never saw that client again, so she probably was going elsewhere, and probably the dog continued to get vaccinated. But it's frustrating because it takes a lot of time and effort to educate people. Now, I've been doing this for so long. We've educated a lot of people. And I think that pet owners are driving the change in veterinary medicine. And I think it's going to take that because the veterinary schools are not changing. The veterinary schools are getting more and more pharmaceutically leaning and more processed food because they get a lot of money from big pharma and big pet food. Those companies will sponsor chairs and professorships at the schools. They sponsor continuing education for all of our ongoing continuing education after graduation. There's a lot of money thrown at the industry. So it's not going to come from the top down from the veterinarians. The change is going to have to be driven, and it is being driven by the pet parents who are saying, I don't, because I think people woke up a lot in the past 5 years to human medicine and big pharma. And I think because we're seeing a change on the human side, you're right. We are now looking at our pets and going, maybe the same thing goes here.
Yeah, and I hear that same side of the argument, like from the medical doctors I've had on here for humans, and they talk about the same thing, like they're just told to just peddle the drugs. And it's because big pharma's in there throwing big checks and they go, we don't want to learn the new tactics. We don't care if it works better. We want you to take our fancy pill because we make more money. And it doesn't mean every person giving medical care is malicious and that they're looking to just do that. They still work inside of a business, and there's an administrative side that gets to make the ultimate decision. And a lot of times, I think you nailed it earlier. You kind of have your hands tied. You don't get to make those decisions. It's kind of like, you have a board that tells you what you can and can't do, which is really unfortunate when you talk about the health of a living creature, your own life in particular, but certainly, our best friends that we cuddle with every night. So it's really important. And if you're just joining us, I'm here with Dr. Judy Morgan, the founder of Naturally Healthy Pets. You can also find her at drjudymorgan.com. You are also a best-selling author. So tell us a little bit about the book that you put out.
I've actually written 9, working on my 10th. And we actually, for your listeners, we are offering 50% off any of the books that I have written on drjudymorgan.com. So if they use the code measuring50, they can get 50% off. So I wrote my first book kind of on a dare. I had joined a Facebook group for Cavalier King Charles Spaniel owners. And it was a fairly small group, a few hundred people. And people, as in any social media, people would ask questions. Well, what do you feed your dog? What do you use for heartworm preventative? How do you prevent fleas and ticks? My answers were always different from everybody else's. And so they finally figured out that I was a holistic veterinarian. And they said, you should write all this down somewhere so that we don't keep asking you the same questions and you have to keep answering them. And I jokingly said, maybe I'll write a book. And then I did. So that started the first book, and then that started my social media. And because I wrote a book and I thought, well, you write a book, everybody just buys it, right? Yeah, no, actually, you have to market a book if you write a book, if you want anybody to know it's out there. So I did. And so from there, I went on. I've written quite a few cookbooks for dogs using traditional Chinese medicine food therapies, because it's so powerful and it's so fun. But I've also written a book on taking your dogs to dog parks. I have a book called Raising Naturally Healthy Pets, which is for anybody who is kind of new to the holistic pet space. Then that's a really good one to start with. It talks about how to find the right veterinarian for you if you want to be holistic. For a lot of people, if you walk into a veterinary office and say, oh, I feed my dog raw food, or I make my dog's food at home using whole foods, most veterinarians are going to freak out. So how do you have that conversation with them, not have them get their hackles up and you not get your hackles up? How do you find that veterinarian to work with? Which is really interesting for me, because when I sold my practices in New Jersey, I moved to North Carolina. I didn't get a license in North Carolina because I'm retired. That's working out really well. So I had to find a veterinarian because I have a lot of cats, a lot of dogs, horses, cows, chickens, the whole 9 yards. And so the horse veterinarian was easy. It happens to be one of my classmates from University of Illinois, lives in North Carolina in the same town. So that was easy. But for my small animals, for my dogs and cats, I was like, all right, well, eeny, meeny, miny, mo, I've got to pick one of these local veterinarians and hope that it's somebody who's not going to freak out. And so I picked one, went in with 4 dogs and a cat. And I also brought with me, because I can do this, I brought all their blood samples, their urine samples, their stool samples, all labeled in their little bags and their little tubes. And I also brought a stack of my books. I think I had like 6 at the time. And so when I walked in, she said, okay, this is really abnormal. Nobody brings spun blood samples with them. Who are you and why do you have these blood samples? And so I told her, and I said, look, I feed my pets raw food. I make my own food. I don't vaccinate my animals unless I'm, backed into a corner. Are you going to be okay with that? I need you for things like surgeries or dental care or whatever. That's what I'm going to need you for. And she said, oh, yeah, that's cool. No problem. I went, all right, we can work together. She wasn't going to argue with me doing things differently. She knew better than to try to push chemical parasite prevention on my pets. She knew better than to push a lot of the chemicals. And if my animals go in for something, she will always ask, do you want the antibiotic? Do you want the pain meds? And, if I want them, I say yes. And if I don't, I say, nope, I've got something else I can use that'll work just fine. And she's okay with that. Finding that veterinarian can be very difficult for the typical pet owner who wants to do things on a different path. And so, what you need to find is a way to have these conversations with a traditional veterinarian and say, can we work together? And it is possible. It's worked for me and a lot of people that I work with their animals online or through, emails and things. We kind of give them hints on, yes, this is how you can manage to make this work. But it can be difficult.
Yeah, I can definitely imagine. I would imagine that veterinarian seeing you walk in with all of those items, that she's thinking one of two things. This is either going to be a dream client or a nightmare client.
Exactly.
And
or,
because
maybe this is a nurse or a doctor who just happens to be able to draw blood on animals. But she's actually been really great. And so for social media, a lot of times we need to film something like an animal having a dental procedure or whatever. We wanted to get her on board with alternative sterilization techniques. So instead of neutering and taking out the testicles, we're like, would you do a vasectomy on one of our dogs? And she says, I've never done one. And we said, well, we'd like you to do it and we'd like to film it. So here's the videos that I need you to watch to learn how to do this. And we're going to come in and we're going to film you doing this for the very first time. And we're paying you for it. And we're putting our dog up as the guinea pig. She was fine. I mean, she's kind of got this personality like, sure, let's give it a try. But, until we start teaching veterinarians that there is another way to do things, they just don't know. They're certainly not taught that in vet school. And that's why a lot of them get defensive. And it's not that they're trying to be mean. It's not that they're, they don't want to hear what you have to say. They just don't know any better. Like, they're not trying to push all those vaccines on your puppies and kittens because they want money. They're doing it because that's what they were taught. They don't know any other way. They can only go with what they know. So I feel like it's our job to teach them as well as teach the pet owners to try to push toward that. And so one of the things that here at Naturally Healthy Pets that we are working seriously on is getting more veterinary students on board.
I love that. Catch them before they learn too much that they can't unlearn the bad habits, right? And there's a lot of truth to that. If you've only learned to do things one way, or even, I put it in this perspective, we've had different conversations on the show with like parenting. When you grow up in a household that's maybe toxic, there's two outcomes really that come from it. You either perpetuate that toxicity, become the next chain in the link or link in the chain, or you completely break it and go the complete opposite way. But the reality is, if you've learned that your whole life, the odds that you're going to get away from doing that are very hard, very slim.
Exactly.
And if you've been through years of training and years of work in the field, and that's the only way you've ever done anything, it's really hard to break that habit. And it's really hard to see that there might be a different side of the business or the healing that you can do that wasn't maybe made known to from the get-go. So that actually funnels into my next question. Where do you see the future of pet health going from current, trends that are happening now?
Oh, the current trends are really bad. And it's interesting because I'm preparing a talk. I'm speaking all over the world this year, and I got some really interesting requests. But quite a few requests have come in for a talk on how big pharma and big pet food are influencing the veterinary industry. And it's not good. Corporate is a huge problem. It's really taking over. And I know we see this. I think it started in the pharmacy industry. So you used to have your mom and pop pharmacies in every town that was owned by, a family, and you had a relationship with them. And then we got the big corporations, Rite Aid, CVS, Walgreens came in. And then those pharmacies started taking over a lot from the doctors. Like, oh, you can walk into a pharmacy and a pharmacist will give you your vaccines. So the doctors lost that business. And then, we got corporate takeover of human medical practices. And now we are seeing the exact same thing. The veterinarians gave away the easy money, which is the vaccines. There's a vaccine clinic on every corner. You could walk into Tractor Supply twice a week and they have lines of dogs getting vaccinated, which is ridiculous. Yes, they're being given by veterinarians, but that veterinarian's not doing a full exam. They don't have a relationship with your animal. They don't know the history. They don't know what problems your pet has. It's totally different than walking into that privately owned practice where you've been going for years. The veterinarian has been treating your animal since it was a little tiny baby. And my practice, I started with clients and we went through 3 or 4 generations of their pets. And we had these great relationships and I knew everything about their pets. We don't have that in corporate medicine. And unfortunately, the biggest owner of corporate veterinary medicine is a candy company. They're also a pet food company, Mars. Mars, their biggest division is their pet food division, and they own 2/3 of the veterinary specialty and emergency clinics in this country. They also
Wow.
own the biggest veterinary lab and the biggest veterinary imaging company, and they are buying up more and more all the time. Now, when you don't have a choice other than to go to a corporately owned emergency service or specialty service, guess what? The FTC actually had to step in because it's price gouging. They can set the price wherever they want because you can't, you go down the street, it's still owned by the same people. You don't have a choice. My daughter had her dog in for vomiting and diarrhea. She had eaten a toy and she was worried that the dog might have an obstruction. Took her in on a Friday morning, had to go to a specialty center just in case she might need surgery. She was there for 48 hours. She didn't need surgery. She got IV fluids and a bunch of x-rays, and her bill was $7,200 for 48 hours without any surgery. That is crazy. People can't afford it. And so now we're getting into financial euthanasia. Like, I can't afford to do that. And the veterinarians are very frustrated because people are waiting so long to bring their animals in. They're like, well, if you'd brought them here when this first started, we could have solved this for a lot less. Now it's going to be really expensive and you can't afford it. So we've got, people, pet owners who are mad at the veterinarians because the prices are so high. We've got veterinarians who are mad at the pet owners for waiting too long, except the pet owners are just scared to death to walk in the door because you're not getting out of there for less than $1,000. Or you take your animal in because they're sick, and while you're there, you get he's overdue for all of his vaccines. We'll give those while he's here. Well, first of all, you should never vaccinate a sick animal. This makes me crazy. Like, I want to take my dog in to have him examined to get his teeth cleaned, and they won't do it unless he's up to date on 15 vaccines. Well, one has nothing to do with the other, and my dog doesn't need all those vaccines. So part of that is corporate medicine has quotas. And the veterinarians are told, this is your quota of Lyme vaccines for the month. This is your quota of fecal exams for the month. This is your quota of heartworm tests for the month. And if you don't meet those quotas at the end of the month, they drag you in the office and say, well, you didn't meet all these quotas. Here's your quotas for next month. You better meet them. And that's not a good way to practice medicine. If you care about your soul, your answer would be, well, I sold as many Lyme vaccines as I thought were appropriate this month. I didn't push them on animals that didn't need them. So we've got a bit of a standoff. And unfortunately, veterinary medicine has one of the highest suicide rates of any profession. And
Wow.
a lot of this is frustration driven because pet owners are angry. Corporate is, owned by private equity, and it's all about the bottom line and making money. So where do I see the future of the profession if we don't turn this around? If the FTC or somebody doesn't step in, it's kind of a nightmare. It's really a nightmare. And that's part of why we are trying to educate pet owners to try to keep you out of the emergency room. Like, you don't want to end up there. So you want to do everything you can to keep your pet from having chronic diseases, from having to be put on all these drugs and chemicals, from having side effects from all the drugs and chemicals that are pushed. So it's pretty critical that we now kind of start taking charge ourselves. I remember when I first retired and sold my practices, I had a client who was texting me, because I'm an insomniac, texting me at 1 o'clock in the morning. And she said, my dog's got bloody vomit and bloody diarrhea, is coming out both ends. This dog is not looking good. I have called 4 emergency services and they're all too busy and none will take him. And she said, I know if I don't get him somewhere in the next 2 hours, I'm going to have a dead dog. It took her till 6 in the morning to find somebody who would actually take the dog. She drove 2 hours to get the dog there. And when she got there, they said, oh man, if you waited another hour, this dog would have been dead. She said, I didn't wait this long. I couldn't find anybody that would even see the dog. So the state of veterinary medicine is a problem right now. And there's a lot of new veterinary schools opening, which will at least put more boots on the ground. But right now, the average work expectancy for a veterinarian is about 7 years. They get in, they can't take it, and they're bailing. It's not good.
No, that's actually eye-opening. Because that there's people with the passion to do it. Obviously, there's a lot of animal lovers out there that want to do their best, and a lot of people that want to join the medical field on both sides of the, aisle, for lack of a better term. And I've heard this over and over again from the human side of the fence. It's like it's daunting to work here. It's depressing. It's
Yeah,
anxiety filled. It's the inability to make decisions for the actual emotional and health benefit of the client. Instead, I'm doing it for the bottom line, like you mentioned, being the
exactly.
statistical quota that needs to be met instead of the individual that needs the treatment or the animal that needs the treatment. We've lost sight of that, and it's really unfortunate that these prestigious careers have been completely taken over by these big companies that only care about how much the return on investment is, and
Yeah,
not like, are we actually doing the good work we set out to do? And
yeah.
it's hard to hear that, because you want to believe that everyone's getting into this for the right reasons and to help their fellow people and animals and, whatever you're working on,
I
but
think
it's
they
not the
do.
case.
I think that the people who the students who want to get into vet school, they're doing it not for money. Because if you're going for money, you better go to human medical school because they make a lot more
Yeah.
money. So they are getting into it for the right reason, and then they get lured. Like I have gotten text messages on my phone, "Hey, we're hiring. We've got a $200,000 sign-on bonus." Now that was never a thing in veterinary medicine until corporate came in. But what these young graduates don't realize is that sign-on bonus comes with a huge price tag to you. You got to stick with them for 5 years. They're going to use you, abuse you, run you through the mill, and make you hate yourself. So what I would, and I don't want to leave your listeners with something negative. So what I would say is to the pet owner like me, find that veterinarian. If you can find somebody who is in private practice and not in corporate practice, that would be great. In some places that can be difficult. Find somebody that you like, and then you treat them so nice. You bring them bagels, you bring them flowers. I had one client, she'd bring me a bottle of my favorite vodka every time she came in. You you bring them stuff. You send them nice messages, send them thank you cards, become their best client. Like you want to be the one who has the A written on your chart that says they're an A level client and we will bend over backwards for them, because that's how you are going to establish that great relationship and keep that veterinarian who's going to really care about your animal because you prove that you care about them. So it's really critical to make relationships. And I would say that for your human doctors as well. And what I hate about human medicine and veterinary medicine is turning more toward it. What the heck does your GP do anymore? Your GP is basically the hub for sending you to 20 specialists. Like
Yeah.
you don't have a GP who knows everything about you and is in charge of all of your medication. And that's really, your veterinarian should be that one person, and you shouldn't have to go to 16 specialists with your pet. You shouldn't have to go to 16 specialists for yourself. You should have a doctor and see, when I graduated, we had a lot more GPs and a lot less specialists. And now we have specialists in everything, which is great, because you want a CT scan, an MRI, some fancy tests, your pet can have it. Your pet needs brain surgery. There are people who can do it. And that didn't exist 40 years ago. And it's great that we have that available. But for me personally, I want that really great general practitioner. Like one of my dogs, he had glaucoma and had to have an eye removed. And we had taken him to an ophthalmologist, a specialist, for his cataract removal when we first adopted him. And I've never met that ophthalmologist because they won't allow clients in the building. So the dog's been there about 10 times, and I stand in the parking lot every time. And the guy will call me on the phone from inside. And I'm like, don't you think it would be nice to actually meet your pet owner clients in person? And I said, why do you not let people in the building? Well, it's corporate policy. Corporate policy for what? Well, it's easier not to have to deal with the clients. Well, maybe it's easier not to deal with the clients, but who do you think pays your salary, dude? Like, I'm
Yeah,
the
that's
one
crazy.
paying the bills here. So, when my local vet tested the pressure in this dog's eye and said, okay, well, now this eye's blind, it's bulging, it's painful, it needs to come out. And I'm like, oh God, please don't send me back to that guy that I've never met that's inside the the gold building that won't, talk to me. And she said, "Well, I can do that." And I'm like, "You can do that surgery here? That is so amazing. Yes, we'll be here tomorrow." I want that relationship, and I want that general practitioner who is willing to do something a little above the, normal give shots. And I guess I like that because that's the kind of practitioner I was. I love surgery. And, I remember I had somebody come to me, their dog needed a kidney removed and they couldn't afford to go to the specialist and their doctor wasn't willing to do it. And I said, "Well, I've done that once before. If you want your dog to be the second one I do, I'd be happy to do it." And she was thrilled because I did it for about a quarter what of the price that the specialist was going to charge. She knew that I wasn't a specialist, but I like surgery and I had done it once before. She was thrilled and it went fine. Yay. But the new doctors are, because they now have standard of care, which means you're going to spend a lot more money, and there's no bending the rules. Um, they're really afraid of getting stepped on by the higher powers, the bosses. They're also afraid of being sued by pet parents if they don't do standard of care, kind of gold standard medicine. And unfortunately, not everybody can afford gold standard medicine, and we need to find those practitioners who can do a lot of that for us and don't require that we always spend $3,000 when we walk in the door.
Yeah, and you're so right about that. And really that's sort of what general practitioner means, right? I remember when
Yes,
I was growing up, I had the same doctor my whole life. It
me
was,
too.
he was the guy that we went to for a broken bone or the flu or whatever. And then as an adult, now that I've got my own kids, every time I have to go to the doctor for a blood pressure check or whatever, just because I'm getting older and keeping maintenance, it's a different person every time. I have no idea who my doctor is. My wife will say, "Who's your actual physician?" I have no idea. Every time I go in there, it's somebody different. They don't know me from the next person that comes through the door.
Mm-mm.
There's no relationship. And I know a lot of it's going to be like from high churn and turnover in the industry. That's got to be a big part of it. But, it was a different time, even, 30, 40 years ago when you literally I had the same dentist and the same doctor for the first 20 years of my life.
Yeah,
And they knew me. And I walked in and he's like, "Hey, I didn't have to look at the chart. He knew my face. He knew my story. He remembered the last time we were in and we talked about something and he brings it up." There's a level of care that comes from that sort of experience and time spent together that is irreplaceable. So to hear of a doctor, whether it's a veterinarian specialist or a human one, that won't allow you into the building while you're being, your patients being like, I could imagine dropping my daughter off and her getting work done and I have to stand in the parking lot. Absolutely not.
exactly.
There's no way.
Exactly.
That's crazy to me.
And veterinarians think that clients should just accept this. Like, "Oh, we're just going to take your dog to the back. You don't get to see anything that we do." And then they bring him back to you and go, "Well, while he was back there, we noticed he was due for his vaccines, so we gave those too." Wait, what?
Yeah.
I mean, that's why I say, really, for your listeners, find that veterinarian that you love, treat them like kings and queens, and really, establish that relationship. So first you have to find somebody that you can work with. And then you really want to, and do this with your doctors, do it with your dentist, whoever, really establish relationships. I mean, my husband, he's a Southerner, so he loves that we moved to the South because when we go to the grocery store, he has to have a half-hour conversation with everybody he sees. I mean, it's just what you do in the South. It's really weird for me being from the North. But, he makes relationships with everybody. The town butcher, oh my God, they're like best friends. So he just, he strikes up conversations and he establishes relationships so that people remember him and then they always do nice things for you. So, if like I can call my local vet, one of my cats, my barn cats, I went out in the morning, his leg was facing the wrong direction and I went, "Pretty sure it's broken." So it's Friday morning. I'm going to call the vet. So I go in the house, I call the vet and I'm like, "I know you just opened, but I got a cat whose leg is broken. I need an x-ray real fast. I'm going to drop him off." She's like, "Oh, sure. Bring him on in." She calls me back 20 minutes later. She goes, "Yep. Needs surgery or amputation?" Well, he's a 9-month-old cat. I said, I'm not going to amputate his leg. But she literally spent 2.5 hours on the phone trying to find somebody who would see my cat to surgically repair his leg on a Friday. Nobody wanted to do it. We called 2 vet schools. They wouldn't do it. They're like, "Oh, we're not accepting patients," or, "Oh, maybe we could get to it on Monday." I'm like, "His leg's facing the wrong direction on Friday. Like, I don't wanna wait till Monday. I know how bad that'll be if we wait." So we found a guy who was 2 hours away, and he said, "If you can be here by 1 o'clock, I can do it this afternoon." I was like, "I'm in my car right now," and the guy was great. And I said to him, "How come everybody else said no and you said yes?" And he was a fairly young board certified surgeon, and he said, "I never wanna be the person who is responsible for an animal not getting care." And I was like, "God bless you. And if I still had a
Yeah.
practice, I'd hire you in 2 seconds flat. Like, you are what this profession needs." And he said, "Well, the problem is I'm gonna admit your cat today. I'll do the surgery this afternoon. He's gonna have to spend the night, so I have to come in on Saturday morning to discharge your cat." And I said, "Okay, I get that." And he goes, "Yeah, but it's no big deal. My wife makes me take the kids on Saturday," and he had little kids. And he said, "So I just bring them to the hospital with me and they get to have fun." And
Nice.
but he was just a great guy. And I thought, "Oh man, we need more of you," because I had 7 other surgeons who said no.
Yeah, definitely need more of those people in the world in pretty much every profession. But,
Yeah,
the ones that go above and beyond and are willing to put themselves maybe at a bit of discomfort or inconvenience, for a better
yeah.
word, to just do the right thing and help someone out. So I got a hot seat couple of questions for you. So
Nice.
since you got all this wisdom you're sharing on us, the rapid fire wisdom from Dr. Judy Morgan. What is one thing every pet owner should stop doing immediately?
Stop feeding ultra processed food. So that would be kibble, dry pet food, because it is basically the same as us eating all of our meals as fast food or ultra processed food. It's like, buying TV dinners laden with salt and chemicals. So there are a lot of pet food companies now that make fresh foods, gently cooked foods, raw foods. If you're okay with raw feeding, which I am, but some people are still scared to death because they've been made to be scared. But fresh food is the difference between good health and bad health.
Which leads me to believe that you just answered question number two. What is the most underrated factor in pet health?
Food, nutrition.
Yeah.
It's absolutely. I mean, yes, we need to stop all the other chemicals and over medicating and over vaccinating and all that, but food is the foundation of life. And if you don't have a good foundation, I don't care. We sell a lot of supplements and a lot of things to improve pet health. But if you're feeding ultra processed food, I don't care how many supplements you throw in the bowl, you're going to have a hard time making things better. And we've seen so many recalls in the pet food industry for really bad things. So we had a huge recall in 2018 and 19 because there was excess vitamin D, which causes kidney failure and death in dogs and cats. So we had tens of thousands of animals that died before somebody figured out that, oh, gee, somebody screwed up the vitamin mineral mix that's thrown in all these foods. So it was a recall across a lot of companies because they all use the same synthetic vitamin mineral mix, which was formulated incorrectly. In 2007, we had the huge melamine recall where tens of thousands of pets died because melamine, those plastic bowls and dishes that we buy, yeah, that's what
Mhm.
melamine is. It was put in pet food to increase the protein content in supplements that came in from China. And again, thousands and thousands of animals died before we finally figured out what it was. We've had recalls for mold toxins, aflatoxins in pet food. So if you have a pet who you get lab work on and their liver enzymes are high, good chance that there's aflatoxins in their food and that's what's causing it. If you get them off the food that has full of moldy grains, then be in a lot better shape. We've had recalls for pet food with euthanasia solution that have killed animals. How does euthanasia solution get into the pet food? Well, sometimes when we test the DNA in pet food, we find that there's dog and cat DNA in there. It's not good.
No, that's actually quite disturbing.
It is.
Um, yeah. Well, I'm really blown away with all the information you've shared today, but also very grateful to have you on, Dr. Judy Morgan. And I wanted to share something with you since we talked earlier about my pug Bowser. Now, several years ago, it's about 6 or 7 years ago now, late night, we were all, happy hour late night. And I found a random site and I ordered something and I forgot about it because it came like 8-9 weeks later. But all of a sudden I get this random package on my porch and my wife's like, well, what did you order now? I go, well, honestly, I don't remember. It was a picture of Bowser as an astronaut. So that's my
Love
sweet
it.
puggle. Yeah. So this is called Crown and Paw. You can get your own, and I don't have any affiliate with them, but that's the company that did this. It's like a Photoshop version of my dog. So I uploaded a picture of her and got the space astronaut dog back. So
Love it.
yeah, if you ever want to get a prestigious picture of your animal, Crown and Paw, check them out. So free perk for them. But Dr. Judy Morgan, you can find her at drjudymorgan.com. She has been so gracious as to give our audience a discount on her books. That is by using the code measuring50. And obviously, you can learn more and more about pet health, holistic, natural, healthy pets. That is the name of her company, drjudymorgan.com. I'll make sure those links and the code for those discounts are all available when we release this video. But is there any final thoughts you have for our furry-friended lovers out there in radio and podcast land?
You know what? Do the best you can. Get at least a little bit of fresh food in the bowl. Give them lots of exercise and love because they give us unconditional love. And frankly, I think our animals are probably the best thing that ever happens to us.
Yes, and I'll end on I love that, and I'll end on something that really struck me years ago when I heard it, and it was, you know, to you, a pet is part of your life, but to your pet, you're their whole life. So your whole
Absolutely.
life can go on without your dog. You'll most likely outlive your animals, but they don't do that. So you're everything to them. So make sure that you're treating them right, taking care of them, feeding them well, give them lots of snuggles and love, and learn more and more from Dr. Judy Morgan. So Dr. Judy, thank you so much for coming on the Measuring Post.
Thank you.